Good day, everyone. Our topic for today is all about the sexual self, the goals, objectives, and the strategies of reproductive health law.
So first, let's talk about the specific objectives of health law. Reduce and prevent mortality rate, maternal mortality ratio, and the spread of HIV. Health law introduced the use of contraceptive during the sexual intercourse of a couple that can prevent the disease that may cause of the death of an individual. Also, to reduce the maternal mortality ratio, health law implement to use the different methods and strategies so that unwanted pregnancy can be prevented that will cause to lessen the rate of the pregnant woman from past to the present and future ratio of women who dies because of pregnancy. Another fact is that the usage of contraceptives can prevent the spread of HIV in the society that introduced by the health law. Next topic that we're going to talk about is the regional objectives of the health law. It improves the quality of family planning, increased use of contraceptives, improve health and nutrition of women all ages for them to have a better pregnancy when they are ready again to be pregnant. Because health law implementation is not all about to prevent the pregnancy, but to have a better pregnancy for the family nor to the society. And the last one objectives is to support other countries' strategies and also reduce maternal and newborn mortality. Next is the advantages and disadvantages of family planning. Mother will regain her health after delivery. Also, they can provide love and attention to her husband and kids. Also, the children will grow healthy and get the attention, love, and care they needed from their parents because we all knew that a healthy child came from a healthy, loving, and caring parents. To the father, burden will be lightened. Also, he can provide the basic needs of their child. Also, they can have a quality time for their family. Aside from those, if they have a serious illness, they have enough time for recovery and treatment of himself. Birth control, health risks, concerns for health of the woman and men, such as allergies or the infections that can caused by the use of contraceptives and artificial family planning. Possibility of pregnancy, because those methods are not a 100% reliable, meaning a woman can still get pregnant even following those methods. The last one is the pregnancy after birth control because women can get pregnant right away after stopping the methods. So now let's talk about the natural family planning method. First is the periodic abstinence or the fertility awareness. It is the observation of the menstruation of a woman. There's a three common techniques used in periodic abstinence: the rhythm, basal body temperature, and the cervical mucus. The rhythm or the calendar method, it is where the couple track the menstruation of the woman to know if the woman is fertile or not. Next is the basal body temperature or the BBT, checking the body temperature of a woman because body temperature of a woman is changing through their menstruation that may classify if they are fertile or not. Take note that if a woman is fertile, therefore they can get pregnant. The last one is the cervical mucus ovulation method or the Billing methods. It is the examining of the color and viscosity of the cervical mucus. So let's proceed to the second natural family planning methods, which is the use of breastfeeding or lactation amenorrhea. This method, the woman will be able to overpower the ovulation. In fact, according to the womanly art of breastfeeding, most of the mothers who are fully breastfeeding their babies are free of menstrual periods for 3 to 6 months or longer, meaning they are not fertile for that time. The last one is the coitus interruptus or withdrawal or pulling out method. The man must release his sperm outside the vagina. It is the method where the penis of a man needs to pull out in the vagina before they release their sperm. So now, let's proceed to our last topic, the contraception or the artificial family planning method. Out of 14 contraception or artificial methods in the family planning, I will only discuss the 7 of those, but don't worry because in the PPT that I will be presented, there will be a definition of all these 14 methods. So let's start. The first method that we're going to tackle is the oral contraceptives. It is the pills that the woman intake after the sexual intercourse of a couple. It contains synthetic estrogen and progesterone that prevents the egg and sperm to create a life. The next one is the cervical cap. It is being inserted in the vagina to cover the cervix that keeps the sperm out of the uterus so that the sperm cannot go to the uterus of a woman, so it will prevent the unwanted pregnancy. The next is the male condoms. It is being inserted to cover the penis of a man that used to trap the sperm during ejaculation of a male. The female condom is being inserted to the vagina of a female to prevent the bloody fluid and semen entering to the vagina. Surgical method ensures the birth control after the inhibited permanently surgery. The two types of it is the vasectomy for men and the tubal ligation for women.
I hope that you get knowledge and learn things about the sexual self today. That's all. Thank you.